Yes, sir.
In the past few years, I've read some things about certain foods, like turmeric and whatever, which retards the amyloid to some degree.
Right.
Is there anything about any of the foods that can work?
Well, so first of all, yeah, a high-fat diet is not good for the reasons I gave, but there have been that turmeric, curcumin, which is actually in curry, there is a lot of credibility to that. And the reason is it's a very good anti-inflammatory. So my colleague Greg Cole at UCLA has studied this, and they actually have trials going on with people who are taking curcumin, which is an ingredient in curry, as I said, and it does seem to have some very useful anti-inflammatory effects, and may be just about the only nutraceutical that I would recommend that you consider. Yes? Yeah, or I'm sorry, I can repeat the questions too. I forgot that time.
On the video, yeah. Thank you. And the microphone on this side as well.
Thank you. One risk factor that you didn't mention is type 2 diabetes.
Yep.
I work for a small company in Kalamazoo, Michigan. It's working on insulin sensitizers. You may have heard of Actos, which is used for the treatment of type 2 diabetes. And in the brain becomes resistant to insulin. Just like in type 2 diabetes, your tissues become resistant to insulin, and you have to keep adding more and more insulin, whereas the insulin sensitizers lower the need for the level of insulin. Now, very recent work has indicated that the target for these drugs is not really what's called PPAR gamma, but in the mitochondria. And it has to do with the pyruvate carrier that transports things through the inner mitochondrial membrane. And could you comment on the incidence relationship between type 2 diabetes and Alzheimer's, which a pharmacologist at Brown University refers to as type 3 diabetes?
So I'm with you part of the way anyway, although I don't know the exact statistics, but there is some connection between diabetes and Alzheimer's, no question of that. Second of all, and I think more importantly, one of the new treatments that I didn't talk about for want of time, basically being pursued by Suzanne Kraft at the University of Washington. They are doing an aerosol spray of insulin, which, you know, your nose is actually one of the nerve endings from nerve cells in your brain actually come out to the surface of the inside of your nose. So it's the one place where the nervous system is exposed, to the environment. She is using a puffer in the nose of insulin and getting some very interesting and promising results. Whether the effect is on PPAR gamma, which is a molecule I have some interest in, whether it's in mitochondria, I think that's not nearly as clear as you think. I personally don't think that mitochondria have much to do with anything in Alzheimer's disease. That said, I could be wrong. I do think it is important. There is an enzyme called insulin-degrading enzyme, which I'm sure you're familiar with, that is important for degrading amyloid beta peptide. So there are connections all over the place between diabetes and insulin and Alzheimer's disease.
Well, just to add on that we have a phase 2 trial now in Alzheimer's, as well as phase 2 trial in type 2 diabetes, as well as research in Parkinson's disease with the same compound.
Yeah.
So
it starts to worry me when a drug is really good for cancer, Alzheimer's, Parkinson's, and heart disease. So, but I agree with you. I think it is important. I hope that you're successful. Yes, ma'am. Well,
yes,
you have to go to the microphone. Sorry. Yes, sir.
I have a kind of a double-ended question for you. The second one I think is kind of interesting. The first one is, what have your studies told you about people in their late 80s or 90s that simply do not have Alzheimer's? What about those folks? What
Right.
do we know? And the other question is, you started your talk with the idea of these overflowing file cabinets. That was a very good analogy. I like that. What can we do about getting another file cabinet? Seriously.
You know, I daydream actually about having a thumb drive that I can just put in right here. It would be so useful. And you know, if it's ever developed, it'll be developed here. It's
It'll be a
interface of biology and electronics and
it'll be a chip.
yeah. So the question is, when will we get a better filing cabinet? Number one, and now actually I'm having my senior moment. What was the first question? Oh, normal aging. Yeah. So there is some literature that would suggest that if you make it past about 91 or 92, your risk for Alzheimer's starts to go down. But this is, this is a matter of controversy. I don't have a lot of data that I could give you to prove it, but my belief is that if you live long enough, you will get Alzheimer's disease. It is sort of inevitable. Even though you have centenarians that are just bright as a bell, absolutely no question of it. But you ask anybody who works with centenarians, and they will tell you the first time they start to see a cognitive slip in a centenarian, they're gone. They will be gone in 6 months. So it just happens very quickly. I think it does happen. I do think it's inevitable, and that's another reason we need to do something about it. Yes, sir.
In medicine, it's important always to establish some kind of a diagnosis. And you were talking about having a diagnosis of Alzheimer's. That's kind of a binary thing. You either have it or you don't have it. But if I think of it as a process, is it actually sort of a continuous process that starts much earlier and you have a little more and a little more and a little more and a little more and you keep going?
Right.
Is that basically correct?
That is correct. And I think the emphasis on the beginning that you have is particularly important. So one of the slides I didn't show tonight, and I wish I had, it's a half a brain of a normal elderly person, and this side over here is from an Alzheimer's patient, and they're like this, okay? Alzheimer's really does destroy the brain, okay? And if that's true, we're not going to know how to fix that for 100 years, okay? So what that says is we need to concentrate on early diagnostics before so much damage is done that we can't fix it.
I'd like to squeeze in another one if I can. You were talking about arteries there, and you showed a couple of examples. The arteries that you're talking about are pretty good-sized arteries. And the implication is that the reduced blood flow, oxygen supply perhaps, may be the thing that's causing part of the problem. My question is, let's suppose that you have pretty good arteries, but you have a blood rheology problem that is especially important for microcirculation. Which you have a lot of in the brain. Okay, is that something that could be comparable to the kind of thing you're talking about with the artery problem in the plaque?
Wow. You're almost, actually you are over my head. I can only say that the arteries that I showed are medium size and that you see as much or more evidence of dysfunction in the microcirculation of the brain as you do, I showed you there. It's just more dramatic there.
Okay, is it an oxygen supply problem though? Do we know the mechanism?
It could be, but no one really knows. This is a expanding area of research.
Okay.
It could be that the brain is hypooxygenated. That's possible, or it's not getting enough nutrients. That's also possible.
Okay, all right. Okay, thanks.
Yeah. Go ahead. Yeah. Yes, ma'am. We'll go back and forth here.
You mentioned that forgetfulness in the aged can be compared to an overstuffed file cabinet. Yet I've seen interviews with apparently normal people, not idiot savants who are functioning well. They're apparently very rare on television who have memories where they remember every detail of every day of their lives. Can that be reconciled with what the overstuffed file cabinet?
Probably not. No, nobody knows how any of this works or why my memory is less than yours and why all of ours is less than some of these people. My guess is they have a lot better connections between nerve cells in certain places in the brain that are used for memory and not others. But I do find that relative to myself, okay, my memory is not as good as it was before, and I do think it's because relative to myself, it's because I filled up that filing cabinet. But I think these other people just got bigger filing cabinets, basically. Yes, sir.
Yeah, I have a simple question. I've read about the word tau, that they found in boxers and
yes.
football players. Is that the same as the amyloid
Yes,
buildup?
so that's a really good question. Actually, Alzheimer's saw two pathologies, not just amyloid. He also saw black thread-like filaments that filled up nerve cells in the brain. We have learned since, he called those neurofibrillary tangles, and we have since learned that the neurofibrillary tangle is mostly made up of a molecule called tau. And it's hyperphosphorylated. It's got too many phosphates on it, and it's structurally unsound, and looks, for all the world to me, like it's just, you filled up the nerve cell with a big wad of steel wool, and of course it doesn't work very well anymore. Turns out that many studies suggest that, in fact, this particular pathology is caused in some way by amyloid pathology. It seems to follow after it, and that's the current dogma in any event. But it is true, and it is particularly seen with repetitive head trauma, perhaps more than amyloid pathology, although you see both. And there's controversy, too. There has been for years between what are called the Taoists, the people who believe that tau is important, and the Baptists, the people who think beta amyloid peptide is the most important. Pat McGeer and I actually coined that because we were tired of listening to them bicker and take up all of the scientific conferences arguing with each other. There is now some kind of consensus meeting of the minds that amyloid is really important and tau is really important, and tau probably comes as a result of amyloid. But there's only, to my knowledge, been one therapeutic addressed at tau. It came from Russia. It worked like gangbusters in Russia, but it didn't work at all in America. I don't know why that should be, but it has not worked. Yes, sir.
Yeah, a quick comment on filing cabinets before my question. The way I expand filing cabinets is I buy another disk drive, and I don't work nearly as hard at remembering things as I did long ago because I file it and forget it because I have good search tools.
Yep. Well, that's good. Bless you.
I'm very interested in, as you are, in the link with Down syndrome. And the thing that occurred to me with respect to that, does that improve the prospects for quicker and more well-funded clinical trials for your work?
It does, actually. That's a really good point. So, as we talked about, preventing Alzheimer's disease makes a whole lot more sense than treating existing Alzheimer's disease, where there's so much damage already, we're not going to figure out how to fix that for a very long time. So we need to prevent it. The difficulty is, how do you run a trial to prevent Alzheimer's with a drug that you think might prevent Alzheimer's disease? Okay? If I've got a treatment, I just get 50 Alzheimer's patients and put them on drug, and 50 Alzheimer's patients, put them on placebo, and see what comes out. But for a preventative, I've got to take people who don't have Alzheimer's and treat half of them with drug and half of them with placebo, and hope, or with the expectation that some will develop Alzheimer's, but some never will, whether they got drug or placebo or not. So, for example, I was part of a study called ADAPT, where we looked at the ability of anti-inflammatory drugs to prevent Alzheimer's disease. You know how many patients we had to have? 4,000. Okay? Statistically, of that 4,000, and these were people who were 70 years old or more and had a first-degree relative who had had Alzheimer's. By those criteria, they would be expected statistically about 17% to develop Alzheimer's disease within the 5 years of the study that we were doing. But we had to look at 4,000 in order to get a sufficient sample of people who would convert to Alzheimer's disease for the trial to make sense. That trial was halted after it had, in a year after it had already spent $25 million. Okay, so hugely expensive to do, hugely expensive. How could we get around that? Well, first of all, as you might expect, I believe that people with Down syndrome should be first in line for the most promising new experimental drugs. But you know what? They also can be the major determinants of their own fate, because we know that that 67% of them are going to develop Alzheimer's disease. So we don't have to have these huge staggering numbers, especially if we're looking for a drug that removes amyloid, because we can image amyloid in the brain. So we can take people with Down syndrome and give them drug or placebo and ask, does it reduce amyloid? So people who are the most vulnerable to Alzheimer's will in fact become the most valuable for clinical trials to prevent Alzheimer's disease. Okay. Yes, ma'am.
Is insulin resistance one of the more early symptoms of Alzheimer's or neurodegenerative diseases? And can medium chain fatty acids that are metabolized into ketones be used as fuel for those insulin resistant neuronal cells?
I don't think that is known yet. That's about the best I can say. I think, as I said, I think insulin and diabetes have clear relevance to Alzheimer's disease. I think giving insulin appears to be beneficial, but beyond that, I just honestly can't answer your question.
Okay, there's a company called Acer that has a product called Exana that I think was popularized by a woman named Mary Newport and her husband who had early onset. I just was wondering if you have any opinion about the use of coconut oil or some of these other medium chain.
But I will tell you, I'm a big fan of Western medicine, and I don't go into health food stores often.
Okay.
Yes. You folks don't have to sit here out of politeness. Go home. I would. But if you've got questions, I will stay here till the cows come home.
Hi, my mother was diagnosed with Alzheimer's very recently.
Diagnosed what?
My mother has been diagnosed with Alzheimer's
Okay.
very recently, last couple of years. It came on very quickly. Before that, she had a lot of short-term memory loss. And I always had this sort of very extremely unscientific hypothesis that for the reason why she had the short-term memory loss. And I wonder if it contributed to the Alzheimer's. And that is, she's always been on antidepressants for as long as I can remember. Way back in the 70s, she was on Valium. And then, many years, she was continuously on things like Prozac-like in the last 20 years. And to me, someone who doesn't take that stuff and I don't know, I get a bad feeling just because she was always happy with them and it changed her mood a lot. And I always wonder, can that stuff alter your brain? Can that stuff contribute to something like that? And that's obviously extremely unscientific. But
Well, certainly drugs like Valium don't make you think better. That's for sure. And indeed, valnasone, a sort of derivative, causes memory loss. If you've ever been scoped, had an endoscopy, and been put under with that stuff, you will find, you can talk to your wife and all kinds of things can happen that afternoon and that night, and you wake up the next day and you haven't a clue. Okay, it's just gone, just erased. So that's true. Does that cause Alzheimer's disease short-term memory changes? I very much doubt it. The place in the brain that is most associated with short-term memory is an area of the brain called the hippocampus. And the hippocampus is just absolutely ravaged in Alzheimer's disease. If it should be this big, it's about that big. Huge loss of cells, huge loss of connections there. And in my opinion, it is that functional, physical loss of nerve cells that is surely not caused by antidepressants. So bottom line is, I don't think so.